I'm Lee Georgi. I'm a cardiologist here at St. Luke's Hospital, and I wanted to give you a brief tour of our new cath lab. This is Cath Lab 1. This is a new state-of-the-art Philips cardiac cath lab. It's different from the other ones because it is a hybrid lab. One thing we did not have before, but we have now, is the capability of doing peripheral intervention. Most of the time in a cardiac cath lab, you're doing cardiac catheterization, coronary angiography. In this cath lab, we can use it for both coronary angiography and also peripheral angiography and angioplasty. And we can do a variety of diagnostic studies in here as well. This is a state-of-the-art detector. It's a flat panel technology that enhances our image quality and also reduces radiation and a variety of other things. This is as good as it gets in terms of cardiac catheterization equipment. Cath Lab 1 is special. I've worked in a number of cath labs in my life, but it's probably the largest one I've ever worked in. Another thing that we're very, very happy about is the color in here and the lighting. Most cath labs in the world, and virtually every one I've ever worked in, is white, gray, cream, something like that, and depressing. Being wheeled into a cath lab can be kind of a scary thing, and wheeled into one that's cold and unpleasant is even worse. So we've gotten lots of positive reviews from our patients about the fact that we put some warm colors in here. The staff and I like it too. It's a nice place to work. As we leave this cath lab, we'll go into the scrub room, which is like any other scrub room. And this takes us into Cath Lab 2. This is the monitoring area, and they have a full panoramic view of the entire cath lab. Once again, the color palette is the same. And it's the same level of technology that we have in Cath Lab 1. We enlarged this room as a function of putting in the new cath lab so that we have more room, and also more room for storage, but also back in here is our inventory room. And there's access to this room from Lab 2 and from Lab 1. So we don't have to be running around the cath lab. We have very close access to getting new catheters, new stents, and things like that. So all three labs are set up in such a way that the technical staff and the doctors can work interchangeably and know where things are and how they operate. And we now enter a sort of a common area here where patients are brought into the cath lab. This is lead. We wear 15 pounds of lead when we do our procedures, and at the end of the week it gets heavier. And this is Lab 3. This is a specialty lab. It used to be for coronary angiography and coronary intervention, but now we use it strictly for electrophysiology. One of the other things that's not thought of a lot is that it's not uncommon to have two emergencies going on at the same time. Prior to the third lab being put in, if an EP study was going on, an electrophysiology study was going on, you only had one coronary lab. Now, that's not a problem. Having the third cath lab allows us to accommodate that. We should walk on down to the waiting room, okay? This room I'm particularly happy about. As part of the whole remodeling of this area, we wanted to redo the waiting room. And this is where families stay while we're doing the procedures. Typically, these procedures do not take a long time, and most commonly, we only have one going at a particular moment, so the families can be alone. Most hospital waiting rooms are crowded and uncomfortable, and I'm really pleased that we've taken this step and used this space for families, because it's a stressful time, it always is. And if they're comfortable, it just makes the experience much less stressful. This is first class. You could get somebody from any other hospital in the country and bring them down here and have them walk in and they're going to be envious. We have brought to Duluth something very important. The level of coronary intervention in this laboratory is better than it's ever been, and probably better than Duluth has seen. And it's only going to get better. Well, that's a brief view of our new cardiac catheterization laboratory here at St. Luke's Hospital. We're very excited about it. It gives us capabilities we didn't have before, and it allows us to be a wonderful regional heart center. I want to thank St. Luke's Hospital, and particularly St. Luke's Hospital Foundation, for funding this project. That, coupled with the professionalism and experience of our medical staff, as well as the professionalism of our technical and nursing staff, makes this a wonderful place to provide care for our patients here in Duluth, Superior, and the surrounding region. Once again, thank you very much.